Welcome to Better with Age. I'm your host, Steve Barnes, sitting in for the Lauren Langell. And it's kind of fitting that I would be here today because we'll be talking about the subject of men's health. And with me here in the studio is Dr. Michael D'Angelo from the Heart of Florida Regional Medical Center. Dr. D'Angelo, thanks for coming.
Good morning, and thank you for inviting me.
Now, let's just talk about you for a little bit. How did you get started in medicine?
Well, it goes back a long ways, actually. I was a little boy growing up in a small town in Iowa, of all places, and my father's best friend happened to be a physician, and he was a true small-town physician where people would do house calls, and I would actually be at his house often when people would come to visit him, and he would take care of them in his living room.
Wow.
And that sort of inspired me to go on and going to undergraduate in the Midwest, and then went on to medical school, and then actually trained at the Mayo Clinic in Rochester, Minnesota for urology training.
Now, what drew you to urology? What is it that makes this field special?
Well, first of all, I mean, the thing about urology, it's kind of a very small niche in the medical field. Mm-hmm. You're basically taking care of from the kidneys all the way to the outside of the genitalia, and that's about it. Mm-hmm. The nice thing is that you can sort of be an expert. You can sort of encompass that entire area because urologists are not just surgeons. We're also medical doctors of that same area. So the nice thing about being a urologist is you really have an grasp and encompassing expertise of the entire system, how it works, how it functions from the basics all the way through the complex. And that drew me into the area.
Now, I'm sure through the time that you've been working in the field, you've seen a lot of advances in, different medicines and procedures and things like that. How has it changed from, when you were in school to now? It's
actually changed dramatically. So, for example, even from the time when I started training in urology, the vast majority of surgeries were still done in an open fashion. Large incisions, the surgeon had both hands inside the body. In fact, there was a lecture I can remember where a professor came to say that we should start doing kidney surgery laparoscopically, with little tiny incisions. And had an old school professor say that would never happen in the world of urology. And flash forward to 2017, and to be honest with you, about 90% of my surgeries are all done with little tiny incisions. In fact, I'm a specialist in the robotic surgery, the Da Vinci robot. Okay. And so we do adrenals and kidneys and ureters and bladders and prostates, all with tiny little incisions. Patients only stay a day or so in the hospital and go home, as opposed to the large incisions that they would stay for a week or two in a facility.
Now, you mentioned the Da Vinci. I had the opportunity to play around with the Da Vinci once, and this thing is amazing. Tell our folks a little bit about how this machine works.
Well, it's pretty incredible. So basically, what happens is the whole idea of using the Da Vinci robot is to make minimal incisions in the person's body, in the patient's body, and that spawned, before the Da Vinci robot, laparoscopic surgery. So if you know a little bit about laparoscopic surgery, they make little tiny keyhole incisions.
Right.
And they put little tubes, little plastic tubes.
And they use the little pincher
instruments. And what it is you insufflate. You actually blow up the belly with carbon dioxide. And so you put little holes, you put little tubes, and you insufflate the abdomen. And the idea of insufflating the abdomen is so that when you put a camera inside, that you have space to look around and see, and you can maneuver your instruments. The problem with laparoscopic surgery, if you've ever seen the instruments, they're very long. They're like chopsticks. They can basically open and close, and they can move, in a twisting fashion. And it's very difficult to get around organs, because organs are not just squares. They tend to be rounded and twisted and convoluted. And so you're limited on how many procedures you can do and what procedures you can do appropriately, or in the same way you would do it in an open fashion. The next step, or revolution if there was, is the Da Vinci robot. And so what the Da Vinci does is you're still going to make little tiny incisions in the abdomen. You're still going to put the little tubes that insufflate with air so you can visualize. But instead of these archaic instruments, we're able to actually connect those tubes 2 robotic arms. And those robotic arms, through fiber optics, are then channeled into a console. And then the surgeon is going to sit at a console. And the surgeon will lean forward, and there's going to be 2 eyepieces, one for the right eye and one for the left. And he's going to look. And that will be connected to small cameras that are inside the body. Now, the idea of the 2 cameras is that it gives you 3-dimensional depth perception as opposed to 1 camera. So a TV set you see in 2 dimensions. You assume depth perception by one thing is larger or smaller.
Right.
In the Da Vinci robotic system, there's 2 separate cameras, just like you have 2 different eyes, and that's how you're able to get true depth perception.
Amazing.
Secondly, Da Vinci robot will magnify your vision to 10 times its normal size. So everything in the robot appears 10 times bigger.
Right.
Lastly, the surgeon is able to put his fingers in what we call grips. And no matter however the surgeon moves his hands, fingers, or wrists, the robotic arms, which are very tiny inside the body, will move and mimic identically. And so you're able to do the same movements, but with the tiniest of little instruments. And that allows us to basically mimic or accomplish the same you would do in an open surgery, but in a minimally invasive fashion.
That's incredible. Absolutely incredible. So with this robot, it opens up a lot of opportunities for new procedures, new ways of doing things.
Absolutely.
You are working on a new procedure, performing a new procedure with the prostate. Tell me a little bit about, first of all, the cause as to why you need to do this, and then explain a little bit about how it works.
All right. Well, first let's just talk about the prostate. Okay, the prostate, if you're a male, as you get older, is going to probably become something of a topic that you'll talk with your doctor about. First of all, the one thing men should realize is that prostate cancer is the most common solid organ cancer in men in the United States. Wow. So one thing that men need to know is about the prostate is they need to screen for prostate cancer, because if there's a solid organ cancer you're going to get, it is most likely going to be prostate cancer.
And that should start happening. The screening should start at
They
what
recommend
age?
Around age 50 that you should visit your doctor, and once a year you should have a blood test called a PSA, or prostate-specific antigen.
Okay.
It is a screening test. It's a simple blood test, and there's a certain value that your prostate should be in based on your age. And if your PSA falls in that value, then the answer is that's a good screen, and if it falls out, then that can be a red flag that it needs to be investigated. Other issues with the PSA is that if the PSA rises too rapidly, so if it rises more than 0.75 in 1 year, that could be an indicator that there could be a problem. Or the second part of the screening, of course, is the physical exam, and we call it the digital rectal exam. Some people will refer to it as the finger wave, if you will. Most men don't like it. A lot of men feel they don't need to have it as long as they get the blood work, but actually 20% of prostate cancers are picked up only with a rectal exam, and the patient will still have a normal PSA. So the prostate is important from that aspect. The second reason the prostate will come into many men's problems or in their medical issues is that it enlarges with time. Right. In fact, if I may, I was going to do a little visual,
Absolutely.
A very simple visual, but if you think about male anatomy, if you draw the bladder kind of like a balloon, that's a storage unit of urine, okay? Right. And then the bladder, of course, needs to get the urine outside the body, so that's going to go through the urethra, right. All right, which we're all familiar through, is going to pass through the penis, okay? And of course, urine is produced in the kidneys, and they're on each side, and they drop urine into the bladder. Now, what many people may not know is that the prostate actually sits wrapped around the urethra. Now, I've drawn this. It actually wraps completely around, kind of like a donut around a straw. And how I've drawn this is, here's the prostate, and here's the bladder, the prostate. And so, as we get older, and as we mature in age, our prostate continues to grow, okay? And as it grows, unfortunately, it tends to grow and narrow the channel. Now, how men are going to recognize that the channel is being narrowed is the fact that they're going to have more urinary issues. They're going to get up at night, maybe once, maybe twice. I have men that get up 4 or 5 times a night, and it really interrupts their sleep.
Right.
In addition, the men may notice they have frequency during the day. They have to go a lot more often than they would like. In fact,
because they're not able to drain that bladder.
Exactly.
Normally.
So each and every time that you drain your bladder, you would like to be able to drain all of it. Mm-hmm. So I always tell patients, if you had a 10-gallon jug and you were able to dump all 10 gallons out at a time, then you would have to dump it very infrequently.
Right.
But if you have a 10-gallon jug and you only dump 5 gallons at a time, you're going to have to dump it more often. So then the frequency will occur throughout the day. Some men get to the point where they literally have senses of urgency, where they must rush to the bathroom, where they could even be incontinent, where they could leak some urine. It can become a very social problem. Mm-hmm. So there are several techniques, and for years we've tried to improve the way men urinate. There are medications that men will take. They're called alpha blockers. What they actually do is they relax the prostatic urethra, they relax the bladder neck and allow the urine to pass through simply. They work to a degree, and for some people they're a good solution.
Right.
There are side effects that go along with any of those medications, and costs. If the medications don't work, or if you're a patient that just says, listen, I don't really like to take these medications, or the side effects are just too pronounced, the next step in prostatic health is sort of something that's new and revolutionary, and that's what we want to talk about today, is something called UroLift. Okay? And basically, what I described is, as we get older, this prostate is growing and it's squeezing the channel. So one of the old ways to deal with the prostate was to go in and do something called a transurethral resection of the prostate. And basically what that was is we would go in through the channel with a scope.
Right.
And we would use an electric loop, and we would actually cut away part of the prostate. And we'd leave a channel like this. Now that works very well, but it requires general anesthesia.
Yeah.
It requires a catheter for several days.
Pain, I'm sure.
Pain, discomfort, and recovery, because it's a true surgery. You may be looking at least 6-8 weeks of having to hold off on certain activities and heavy lifting and things like that. There's also some downsides. So another purpose of the prostate, of course, is sexual. It produces semen. So when we do the old-fashioned transurethral resection of the prostate, men will get what they call retrograde ejaculation. The semen will go back into the bladder. It's not a large deal, but it can be uncomfortable for some people. And a lot of men don't like that. This new technique, the UroLift technique, what it has done is it sort of changed and revolutionized the way that we think about improving urination and prostate health. Because just as before, the prostate grows and the channel is squeezed together. In this technique, what we're able to do is we're actually going in through the channel, but we don't have to use general anesthesia. We can just use a very light sedation. So for patients who have significant cardiac disease or lung disease, or even just patients in general, less anesthesia is always better.
Right.
And the nice thing about this technique, it's so simple, so quick, and so easy that it allows them to go under this procedure without having to have a general anesthetic. And basically how the technique works is what we want to do is, because the prostatic lobes have grown, we want to pinch those prostatic lobes back together. So instead of cutting away the tissue and actually changing the entire anatomy, all we're doing is just simply pinching the lobes and opening the channel back up.
Creating more space for flow.
Exactly, creating more space for flow. So how the technique will work is we go in with a scope through the penis. There's a needle that will pass through the urethra, through the prostatic tissue, all the way to the outside capsule of the prostate, actually able to leave or deposit a little T-brace. Okay. So it's kind of like if you go to Home Depot and you screw a toggle bolt through the wall.
Right, an anchor.
Anchors on the other side of the wall to hold it in place. And attached to this little T-brace is a suture. And what we do is we just tighten the suture and we put tension and we squeeze the prostatic lobe together. And then we're able to fire another little surgical clip on this side, and it will squeeze the prostate. What will actually end up happening is, instead of the prostate in the same position, it will actually squeeze the prostatic channel back. And then what we do is we do the same procedure on the opposite side. And we do it down below, and we put 4 clips or tiebacks, if you will. Very similar to if you had a curtain in your living room and you decided that you wanted to open the curtain for light. You would put 2 tiebacks at the top, 2 tiebacks at the bottom, and all of a sudden you have a wide open channel.
Wow.
And this procedure literally can take about 10-15 minutes with a light sedation. The patient will then be able to leave the same day, go home. Most will wear a catheter. If you know what a catheter is, a tube that goes in the bladder that drains bladder, just overnight. They'll come in early the next morning and we remove it. And at that juncture, they'll actually have significant improvement in their urination. Now,
that's amazing.
It is quite amazing. And the wonderful thing is, you know, if you go through the, like we said, the surgical technique, you may have multiple weeks of irritation and burning and restrictions. The nice thing about this technique is it takes about 2 weeks, little irritation, probably no longer than 4 weeks. But during that time, you can actually go back to doing all your activities within just a few days. And the wonderful thing about the procedure, of course, is that people say, well, okay, that's all fine and good, but how long does it last?
Right.
Has anybody looked to see, is it going to help me not just 1 month from now, but I want to know 1 year, 2 years. So this procedure has been in the United States for about 5 years. And the wonderful thing about this procedure, they've studied it quite intensively.
Right.
And so basically what they found is that following these men after the procedure for up to 5 years, about 90% after 5 years will be as good as when they had the procedure done. Wow. So it does have longevity.
That's awesome. And you said it really doesn't impact like a regular surgery would. It's just a sedation. There's no...
Exactly, and that's the amazing thing. I said it's just simply a light sedation where you drift off to sleep, you don't remember or feel a thing, and you wake back up. You pass to your house. The next day you can actually go to work or do whatever you would like to do. And that's why it has dramatically improved the way people tolerate this.
And so this right here,
absolutely,
this is what we're looking at.
So if you look at this, it may be difficult to see, but this is actually the implant itself. And of course, there's nothing about the implant that the body hasn't tolerated in the past. It's made of stainless steel surgical clip and some suture, which of course for years and years, surgeons have been placed in people's bodies without problems.
Yeah.
And so basically you have the little clip that goes on the outside, the suture that's tightened, and then the other clip that's placed on the inside. And we talk 4 of those clips.
It kind of looks like one of those clothes tags, you know, like when you buy a new shirt and it comes with the little...
It's identical. It looks exactly like that, but of course it's made out of, surgical material and stainless steel surgical clip, but that's exactly it.
That's so cool. This is amazing, revolutionary. It's a really cool thing that you're doing.
Well, we're very pleased. We've had some excellent results. We've had patients. I had one nice gentleman, unfortunately came to me wearing a catheter. He just could not urinate and had a catheter for over 2 months. And we did this procedure. We took the catheter out the next morning and he was able to urinate. And he basically felt like he got his life back.
Life-changing for these men that are having issues with their prostate.
For this individual, it was a life-changing experience where basically he had stopped doing his activities. He stopped riding his bike. He stopped exercising. He stopped doing all the things that he loved to do outside. And now he's back doing all of those activities simply with one procedure.
That's amazing. Well, Dr. DeAngelo, thank you so much for coming in and sharing with us. We really appreciate it.
Thank you very much.
That's all the time we have in this segment, but stick with us. We'll be right back with more of Better with Age.
When I was 6, my mom had a stroke.
I'm Paul George. Learn the signs of a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Spot a stroke fast.
Welcome back to Better with Age. I'm your host, Steve Barnes, sitting in for the Lauren Langell. Now, last segment we had a great conversation with Dr. Michael DeAngelo about new treatment that he's doing, but we kind of want to flip the script a little bit, talk about mental health coming up. we're coming up on some of the holiday season, and a lot of times folks, lost family members, lost loved ones can be a really tough time. So here to talk to us today about mental health in the holiday seasons is Mrs. Candace Barnes. Yes, she is my wife. She is the Director of Outpatient Therapy Services at Peace River Center. Candace, thanks for coming on.
Thank you.
Not like you had a choice or anything. No, I'm just joking. So, Candace, what types of things impact people's moods and the way they're feeling around the holidays?
Well, there are a really substantial amount of people who experience kind of what we would call the holiday blues. And it's not just loss or memories around the holidays, although that plays a really significant part. But the holidays are a really stressful time, and there are a lot of stresses put on you, not just by yourself, but by other people in forms of expectations. There's a lot of pressure to have things a certain way or to have an experience turn out a certain way. And oftentimes reality does not match up to expectations. Yeah. And that can be the pressure to, see all your family. And when you get older, a lot of times that doesn't happen, and that can leave you feeling sad or lonely, or it can be the pressure of having to have all of your family, and that provides its own unique set of stressors depending on how your family is. And there's just so many things that lead into people just having a general kind of down feeling around the holidays. There's all of this expectation that it's going to be magical and it's going to be wonderful, and reality really just doesn't always match up to those expectations.
So let's focus on stress for a moment, especially as grandparents and things like that may be in charge of organizing all of the family to get together. What are some of the things that folks can do to try to alleviate some of that stress during the holiday?
Well, the first thing you can do is not sacrifice your normal healthy habits for the sake of the holiday season. So if you're generally an active person, don't give up your active lifestyle to put on an event for your family. People who are less active have higher rates of depression. And that also leading into that is some of the things that we do around the holidays. So if you drink or things like that, alcohol is a huge depressant, and if you're already feeling a little bit low and then you drink on top of that, you're going to feel lower because that's just biologically how that works. Yeah. You can do simple things like stay within your means. If you're overspending around the holidays, you are preparing yourself for future stress. Yeah,
money can be a huge stressor.
And then, things like not being afraid to say no. You don't have to do everything that's expected of you. You can choose what you want to do. Yeah. And there will be some disappointment for others, but you kind of have to weigh out, what am I willing to live with? The person being disappointed with me or my own happiness and health? Yeah. So it's okay to say no sometimes.
How do you work about making compromise with family members? Because, typically, when we talk to strangers, we're real nice to strangers. We treat them with courtesy and respect, and we try to be as nice as we can, but oftentimes family members are the ones that they're so comfortable with each other. They get pushy, they demand.
Sure.
How do you deal with some of these elements of the family?
Well, every family is different, and so every family dynamic is unique to that family. I think that it's really important for people to understand the concept of healthy boundaries. And all that is I have a really clear understanding of what's my responsibility and what your responsibility is. And it's not your responsibility to make sure everyone else is okay all the time and everyone else is happy all the time. And that just means that every once in a while, people are going to have ideas about what it is that you should do that maybe aren't what you need to do for yourself. Yeah. And you have to find a way of communicating that, but every family is different. And so how every family negotiates, that's going to be very different, and it's going to have a very different result. So people are the expert on their situation. They know how their families are. They know what to expect. They know who's going to, be the issue at holiday meals and things like that. So in as much as you can, without creating more anxiety for yourself, just being mindful of how your family is. You might have to set boundaries.
Now, family is a huge stressor when they're there, and it can be a huge bummer when they're not. Not being able to be with family, how does that affect people's moods?
Well, I mean, I think that people can have a variety of reactions to that. It can, you can have all of your family there, and then the day after they're gone, you start to feel sad and down.
Yeah.
It's the post-holiday blues. You can have expectations that people are going to come and see you, and they never show, and that kind of loneliness, you know, it really can weigh on a person. Yeah. I think what you have to watch for in terms of sadness that comes out of loneliness is things that kind of go beyond just the holiday blues, which are really common, and kind of lean more into something that's a little bit more serious. So if you find that it starts to really affect your mood, and your mood is very different from how it normally is, either you find changes in your appetite, that you eat a lot more or a lot less, if you're having trouble sleeping or you're sleeping all of the time, when we're looking at things that might be leading more into depression, we're looking at extremes. So one end of the spectrum or the other. If you see those things happening, it's really important to talk to your healthcare provider. Even if you've never seen a mental health care provider, going to your primary care doctor, most primary care doctors screen for depression and things like that, and can refer you appropriately. It's a really good idea to get things like that when it's changing your day-to-day activities, your feelings are changing how you live your life. It's really important to talk to someone about that. And if you start to feel it happening, you can do some things to try and prevent it a little bit. When you feel like you just want to be alone and isolate, that is the most important time to find people to be around. It's not really good to be isolated all the time. So that might mean you need to find a new activity to engage in, something that you enjoy to do a couple of times a week. You need to be exercising, doing something physically that you enjoy, that releases natural endorphins and things that help kind of boost your mood in a healthy but natural way. But at some point it can get to one of those extremes, and when that happens, you really do need to see a healthcare professional.
So when somebody senses that they're leaning more from just kind of like feeling kind of disappointed that the family's gone, to actual mood changes, to actual behavioral changes, I mean, is that something that a lot of people self-realize, or I mean, is that difficult to understand what you're experiencing when you head into depression? Like, it's easy to say, oh, well, if you're feeling depressed, you should do this, this, and this. But I mean, isn't that kind of the whole thing about depression? Is it sneaks up on you? It happens without you really being able to even recognize it. Yeah,
you're like, oh, it's been a week and I haven't been out of bed. Something is wrong. Everyone's different, and I will preface this with everyone's different. So some people are a little bit more self-aware than others, but in general, people aren't that self-aware. And so it might be someone that you know and you care about saying something to you like, oh, you don't seem like yourself, or, we've scheduled these things to do together and you keep canceling. Is everything okay? I mean, other people might be pointing it out to you. Pay attention to them. If they know you and they know how you typically are and they see something, that's probably valid. But yeah, you're right. We're not typically super self-aware. We don't usually see the forest for the trees sometimes when it's ourselves. So sometimes it'll be someone else that might point it out to you.
Now, when you do recognize it, whether a loved one helps you understand what you're going through, or you recognize it in yourself, kind of I gather what you're saying is you almost have to force yourself to do the exact opposite of what you feel like doing. So, you feel like going and drinking your sorrows away, but stay away from the alcohol. It's going to make things worse. You feel like not getting out of bed, but force yourself to get up and exercise and do things like that. Oftentimes, it's the opposite of what you're feeling.
That's exactly why I said it's really important to talk to a healthcare provider, because what your instincts will tell you to do are not the things that are going to help you feel better. And in some cases, if there is clinical significance to what's going on with you, you might need help from the healthcare provider to feel better. So that's why it's really important to do that. That can be something that is a little bit scary to navigate. That's why I say if you're only comfortable going to see your primary care doctor, do that. Start there. Yeah. They'll help you move to the next piece. But there are a lot of resources in the community for mental health care, and most of them are, I would say, fairly easy to access in terms of, calling, finding when you can either walk in or get an appointment. But one extra layer that does provide a little bit of, I wouldn't say trouble, but maybe a little extra layer of something to navigate is that if you are a senior and you're using Medicare, then there's only certain types of mental health professionals that you can see and can accept that insurance. And so
now, are there like hotlines, depression hotlines, things like that that folks can...
There are national depression hotlines. There are suicide hotlines. Locally, Peace River Center has a crisis line that you can call 24 hours a day, and someone will answer and kind of walk you through either what's going on or if you need to do something.
To get you through that immediate need. Yeah. It's interesting that so much of your mental health is tied into your physical health.
The two are completely interconnected. And so, your head is attached to your body. And so
at least for most of us it is.
For most people. So your thoughts and your feelings and your mood are directly impacted by your physical health. And it's not always one's causing the other. You can have an issue where you have chronic pain, and that can greatly affect your mood and the way you feel about interacting with other people. A lot of people post surgery or major operations have some changes in moods or behaviors for a little while after that, because your body is recuperating, and that takes a toll on your social emotional world. And then just the opposite of that, you can have someone who has high anxiety, and that person tends to have high blood pressure or other physical things like that. So they go hand in hand. So it's really important to take care of both parts, because if you only take care of one, you're taking care of it at the expense of the other.
Very good. Well, Candace, it's really great that we have such a terrific service here in the county with Peace River Center. How do folks get in touch with them, if they're going through something, phone number, website?
Sure. So Peace River's website is peacerivercenter.org, and Peace River Center is all one word. Our crisis hotline is 863-519-3744. And if you're interested in becoming a client or coming in and talking to someone, you can call our Access to Care line, and that number is 863-248-3311.
Well, Candace, thanks for coming in. I'll see you later tonight.
Okay.
Well, that's about all the time we have for this episode of Better with Age. I'm your host, Stephen Barnes. Thanks for watching. If you want to catch up on our previous episodes, you can always see us on YouTube. And we'll catch you next time here on Better with Age.